Hello, I am Dr. Sangeetha. I am a fertility specialist. I am into reproductive medicine and cosmetic gynecology, practicing at Coral Advanced Fertility Center, New Bell Road. PCOS, Polycystic Ovarian Syndrome. We all have heard about PCOS, and it has become one of the most common causes of infertility and irregular periods, and one of the most common causes of anovulation. And this PCOS comes in all shades of gray. What is PCOS? Polycystic ovarian syndrome. It's a complex endocrine disorder wherein there is insulin resistance, more of male hormones like androgens present in the body, or the ovaries are big with multiple small fluid filled sacs. That's the reason we have called it polycystic ovaries. So the important causes of polycystic ovaries are it can be multifactorial. It can run in families, it can be due to genetic predisposition, it is mainly because of insulin resistance and other disorders causing elevation of male hormones in a female, that is elevated androgen levels in a female and insulin resistance. So these two culprits, it can result in PCOS, and the causes can be anything from familial to environmental. And some patients, though they appear normal for a particular weight, and PCOS will be unraveled after they gain sudden weight, or if they are put into stressful conditions, the symptoms might come out in a normal patient who was never diagnosed as PCO. So PCO can present as it can be asymptomatic. So person will be ovulating normally, still she can have PCO. Patient can have irregular cycles, and along with other criteria, if they fulfill, they can have PCO. Patient will be having too many acne or too much of hair fall. There will be some skin thickening around the axilla and nape of the neck. There will be skin tags, and there are some other associated conditions along with PCO which can exaggerate the condition. So we have to screen them for other associated disorders like diabetes, abnormal lipid profile, and we have to keep a check on their weight gain and their lifestyle. So the common symptoms again are irregular cycles, anovulation, acne, and increased hair growth in a male-like pattern, increased hair loss or baldness like a male pattern, along with some skin tags and pigmentation. When a female presents to us with irregular cycles, or if she is unable to conceive, or she is having too many acne or hair fall, and we diagnose her presumptively as PCO based on some history and clinical examination and basic ultrasound. So in baseline ultrasound, we can see the ovaries are little more than the normal size with multiple follicles, and we have account for that more than so many follicles in each ovary. We just put them under the category of PCO. Along with that, we do several hormone tests to make sure that she is having some androgen excess or insulin resistance. And along with that, we have to know her lipid profile, and we have to treat her for any other associated symptoms like depression or anything which will be seen most commonly in PCO obese patients are infertile or having some other problems related to that. And how do we treat them? So treatment again depends on what they want. So some patients with irregular cycles, or sometimes they'll be having permanent amenorrhea, like only they respond to tablets that we call only withdrawal bleeding. That is, every time they have to menstruate, they have to take some hormones for them to menstruate. So some women just have to come to us who have completed their family, still they'll be having amenorrhea or irregular cycles. So we take care, like at least once in 2 months, if they can menstruate, it's enough. So once they come, we'll have to again make sure that they are not diabetic, or if their diabetes is under control, we again tell them about the diet, importance of weight loss, importance of lifestyle changes to decrease the stress in their life, and there are some nutritional changes like what they should eat, what they should not eat will be taken care of, and it will be different for each patient. So with some dietary modifications and minimal treatment, they'll be able to lead a normal life and they don't have to worry about anything. People who wish to conceive because of PCO, they will not be ovulating in majority of the cases. They have to undergo some tests for them, and we'll start them on ovulation induction protocol so that they ovulate, and we'll tell them exactly when they are going to ovulate, and so that they'll have a timed intercourse, and followed by other medical problems like thyroid or prolactin levels or whatever is associated will be taken care in PCOS, because PCOS will have some other associated disorders along with PCO like endometriosis or fibroids or any other disorders, because these hormonal changes, hormonal imbalance go sometimes like friends hand in hand. We'll have to sometimes screen them for so many other associated disorders and treat accordingly. And as I said, each person with PCO comes with different symptoms, different requirements. So each will have to go individualized therapy, like some might require just dietary and lifestyle changes along with weight reduction, some will require minimal medications, some will have to regularize their periods, or some will have to do laparoscopy and sometimes ovarian drilling. We now rarely do, but for some patients it will be indicated, and along with that they'll have to be like very careful, and they have to undergo screening every 1 or 2 years just to make sure that other associated complications like diabetes or lipid profile problems or obesity, coronary artery disease have been screened and they are in good health, because these people are also prone for diabetes, coronary artery disease, depression and hypertension.